Hi, I want to go over just a little brief situation here with a patient that came in last week. A gentleman called in complaining of knee pain and wanted to be evaluated. And when he came in, he brought x-rays from the hospital of his knee, and the joint looked relatively good. Nothing really severe based on the kind of symptoms he was presenting with. Um, there was some laxity in the joint. There were some mechanical issues and instability that we found when we did the exam. In going over his history, found out he had a chronic issues with low back for years, and had had some injections for pain and so forth, but he never completely ever got over that. Well, uh, examining him further, we found that there definitely was some low back issues, so we sent him out for x-rays, and when he brought those back the next visit, we looked at him, and he had horrible deterioration in the lower back from L3, L4, L5 and L5S1. The L5S1 disc was practically gone. It was almost your proverbial bone on bone. And going back then neurologically, remember we talked before in another video that 23% of knee pain is neurological in origin, and those are from the tendons and the ligaments in and around the knee. But also the lumbar spine has 5 nerve roots exiting from it, and 4 of those contribute to support to in and around the knee. And this area in particular, the L5S1 area, is where the bulk of these sensory nerves and motor nerves go. And this was the majority of his problem, was his lower back. So in treating him after the initial session with the things that we do for low back and some supportive things for the knee, when he came back, he had a significant change and a good response with decrease in less pain. So the moral of the story is this: if you go to a provider and your doctor examines you for your knee and he doesn't examine your lower back, even if you've had low back issues or not, specifically if you've had low back issues, that should be a red flag. And if not, at least it should be examined regardless. In particular with people that have had back surgery. Every one of the back surgery patients that we have seen have had some sort of knee involvement, whether they came in primarily for their knee or their low back, they had both. And so always make sure, no matter who you go to, that you request and question if they do not evaluate or examine your lower back.